Introduce to you all. This is Canoe. He's a very sweet, lovable boy. He loves to lay around. He came to us from OAS and is waiting for adoption. I wanted to mention right now until the 28th, Canoe and our other adult dogs are available for adoption for free. So if you are looking to add a furry friend to your home, check out our website of all our adoptable animals.
Canoe's great. He's built for comfort, not speed.
All right. Let's see. All right. So it looks like we have a good number of people here. Again, my name is Lindsay Stutz. I'm the Major Gifts Manager here at East Bay SPCA. And today we're excited to highlight Inside Shelter Medicine, Healing and Saving Animals, featuring Dr. Josie Noah, the Veterinarian of Shelter Medicine. Next, I'd like to introduce Julie Henderson, our VP of Philanthropy. She'll be joining us for Q&A later. So if you have any questions, please use the question box at the bottom of your screen and we'll get to your questions at the end. It is now my pleasure to introduce President and CEO Allison Lindquist to say a few words.
Hi, everybody. Thank you so much for joining us today. We are so excited to have Dr. Josie speak to all of us about the incredible work that she does working with our shelter medicine team and all of the interesting things that she sees and does. We could not save the animals that we save without Dr. Josie and her fabulous team and her staff that see everything that you can imagine from the community and the animals that we pull from our municipal partners, that we take in as strays, that come to us as returns, all the ways that we are a safety net for the people and pets in our community. So with no further ado, I would like to go ahead and turn it back over to Lindsay, who will move us along.
Thank you so much, Allison. Without further ado, Dr. Josie Noah has served as our shelter veterinarian since 2021. Dr. Noah oversees the health and well-being of our entire shelter population, providing individualized medical care and performing a majority of the surgical procedures for our animals. Thank you so much, Dr. Noah, for joining us today, and take it away.
Okay, thank you. I am excited to be doing this talk for you all. I think shelter medicine is extremely exciting, and I'm looking forward to giving you a behind the scenes kind of look into what we do every day here. So about our shelter medicine team. So in 2025, we served more than 3,500 animals at the East Bay SPCA. Generally, we have 100 to 300 in care at any time, and that's pretty seasonal. Right now, we have 106. So winter tends to be the slower time of year. And then at the height of kitten season, it can be up to 300 animals, and we are running and juggling a lot at that time of year. During that high time, we have up to 200 in foster care. And really, at any particular time, usually it's about 30 to 40% of our shelter animals are receiving veterinary care and are being overseen for a variety of issues that I'll talk about. At this point in time, actually, it's about 50%, and I will talk about some of our cases in a minute. My team is made up of me. I am the one shelter veterinarian here at the East Bay SPCA. You may know that we have a public clinic. There are a couple of veterinarians there, 3 to be precise. And we do have our spay-neuter center, which also has a full-time veterinarian there doing surgeries. But here at the shelter, I am the one designated shelter veterinarian, and all I do is oversee our population, deal with our animals' medical needs, and I do the majority of their surgeries as well. The spay-neuter center and the full-service clinic sometimes do help out with surgeries. My team is 6 support staff, and we could not possibly deal with our up to 300 animals at a time, 40% or more needing medical care without the support of my incredible team that is keeping an eye on the population. There are 2 RVTs. Those are registered veterinary technicians. They have advanced training, and 4 assistants who are also incredibly skilled. One of them is at our Dublin shelter. So we have two shelters. The Oakland shelter is our main facility with our clinic and our medical base is here. And then our Dublin shelter is a satellite shelter. We do have one shelter medicine staff member out there who's helping with the medical needs of those animals. My team is providing medications every day. They're performing medical diagnostics and treatments that I request. They are applying a large number of protocols. So, our common issues that come in, they have a standard protocol where they can assess and start treating those animals right away. They are supporting me with surgeries 2 days a week, and they are also overseeing all of our foster care. So they're arranging fosters, they are communicating with those fosters, they are available when fosters have questions or concerns, or we need to check in and see how an animal's doing that might be under medical treatment. They're dealing with all of that communication. They are also arranging our field trips and our sleepovers and are supervising those as well. My team works 7 days a week, including holidays. We have 2 surgery days every week, and on each of those days, we do from 10 to 24 surgeries, depending on the complexity. A lot of those are spays and neuters. Of course, every animal that comes through here is adopted out, spayed, or neutered. And most of those we are doing in care. But we have many, many other surgeries that we're doing as well. I'll talk about some of those, but common ones are eye removals, mass removals, amputations. Those are our biggest ones. Sometimes cherry eye surgeries, a number of other things. Really anything that comes along, we'll do it. So this is in our shelter med office. I know you can't really read any of this, but this is how we track all of the animals that we are caring for. So the left half is dogs, the right half is cats. I counted these up this morning and there were 47 on this board. This is just for our Oakland side and our Oakland fosters. So there's another board in Dublin that has another few animals on it. So right now I calculated this is actually 50% of our animals are under veterinary care right now, and we do have some pretty complex cases going on at this time. This is a picture of our space. This is not our full team. As I said, we have 6 assistants, but this is our little space, what it looks like. We've got treatment area. We've got 3 computers where we're entering our medical notes and plans. We've got many, many cabinets full of supplies that we're using to treat our animals, a scale. There's a tub on the back right there where we may do medical baths that are needed for skin issues. And so all of us are working in this very small space to help our shelter animals. There's also an office next door where we do foster care as well. So who are our animals? So as I said, we have about 3,500 in 2025, and I ran the numbers, and a little more than 1,000 were dogs, about 500 puppies, about 500 cats, adult cats, and more than 1,400 kittens. So kittens is really a lot of what we're doing during the kitten season, and kittens tend to have a lot of medical needs. By source, animals come in from 3 primary sources, but there's a couple others as well. So more than 1,700 of those were strays, and those strays are generally coming from our stray contracts, which are with the city of San Leandro and the city of Livermore. We provide sheltering services for those 2 cities. We do not do the animal control. Both of those cities have their own animal control officers, and those people are doing the in the field work and then bringing animals to us as needed. Also, members of the public are bringing strays to us from those 2 cities. We also get strays from a number of other cities. Oakland, of course, because we have a shelter in Oakland, people will often show up here with Oakland strays, and if we have the capacity to take that burden off of Oakland Animal Services, we will take those animals in. Sometimes people are turned away or, cannot make it to other local shelters, and we will often take those animals in as well. We do also do a number of transfers, about 1,100 last year. Many of those are from our local shelters that are overburdened, our municipal shelters. So those may include Oakland Animal Services, That's one of the main ones. Antioch, East County. There's a number of shelters that we do take transfers from, and sometimes farther afield as well. Sometimes from the Central Valley or other places that may request our help. We do take owner surrenders. So that was a little more than 350 last year, and those are from San Leandro and Livermore. We are contractually obligated to take those owner surrenders as needed, but we also have a process for helping take in animals in need that owners can no longer care for any variety of reasons. But we do have an application process and we do a behavior and medical evaluation. And if we have the medical and behavior capacity and the time and the space to take those animals in, we will help people out with owner surrenders. This doesn't quite add up to 3522 because we do have a few other sources. One of those is our Hold for Home program. That is part of our humane advocacy program. People who are experiencing temporary hardship and need care for their animals due to housing instability or perhaps a medical crisis, number of other issues, we can take animals into our care for a period to care for them. Protective custody, animals who are brought to us by our local animal control officers for protective custody is another source of intake for us. Okay, so you may or may not know that there are three general types of shelters. One is municipal, so those are city agencies, city or county agencies that are taking care of the strays in their area. So Oakland Animal Services is an example, Berkeley Animal Care, those are some of our local municipal shelters. There are private nonprofits with municipal contract. That's the category that we fall into. So we are a nonprofit, but we do have contracts with a couple of cities, so we do take in strays and owner surrenders from those areas. There are also private nonprofits that do not have municipal contracts, so they are only going to take in transfers that they select from other organizations. So Joybound is an example, Milo Foundation in this area are a couple of examples. I did want to point out, because a lot of people don't know this, that each of the SPCAs and humane societies are all independent. None of them are affiliated with each other, and we are not affiliated with a national organization. So while we all do share a name and may have been started long ago with similar sort of philosophies, we are all independent organizations. Okay, so let me get into shelter medicine specifically. So much of what we see in shelter medicine is what your general practice veterinarian or your emergency veterinarian might see, all kinds of individual health issues. But we also have a category of what we do that is different than those fields, and that's population management or herd health. So because we are a shelter, we have animals coming in from a variety of places with a variety of backgrounds, and we don't necessarily know what's been going on with them. There is a risk of bringing all these shelters together animals together in our shelters and having infectious disease happen. This can be a high stress place and, close housing. And so diseases can spread here. We, and hopefully most shelters, are doing everything in our power to prevent that. So we do intake screening for infectious diseases. We're looking for things like ringworm, which is a skin fungus, parvovirus, panleukopenia. These are viruses that puppies and kittens have that are easily spread in an environment if you don't take precautions. We are at intake doing preventative care for our animals to hopefully prevent infectious disease from taking a hold or spreading here. We vaccinate every animal at intake, and we do parasite prevention in the form of deworming and flea and tick prevention for those animals when they come in. So hopefully anything they're coming in with, we're getting a handle on it right away. And if something is slipping through, we've got vaccinations on board so that hopefully our animals are protected. Despite our best efforts, sometimes animals do come in without symptoms and then they break with an infectious disease. When that happens, we need to track everybody who's been exposed, do quarantines, do whatever kind of preventative care we need to do, and prevent outbreaks from spreading. Additionally, we are overseeing the housing, the cleaning, the care protocols, along with our animal care teams to make sure that we have a clean environment and that we're not spreading diseases around. We also need to take a look at our individual health. So we are assessing individual health concerns from basic to very, very complex with little background. We have some very complex surgical cases that come through. We can have complex chronic medical issues that we're dealing with. And then there's also acute illnesses and emergencies, either that animals are coming in with or that they're developing while they are here. It's important to keep an eye on behavior, health, and well-being or welfare of all the animals in our care because increased stress leads to reduced immunity, leads to increased illness in our care. So that is something that us, in addition to our behavior team and our animal care team, are keeping a close eye on. And then while we are doing lots of medical care for all of these animals, we also need to be aware that our resources are finite. And so we need to be strategic and thoughtful about how we're managing our resources for our animals. Okay, so what makes shelter medicine challenging? Well, I think every veterinarian will tell you that it's maybe frustrating is not the right word, but challenging that our animals cannot tell us how they feel or what's been going on for them. Additionally, in shelter medicine, we often don't have any history. We have animals that are coming to us stray, and we have no idea how long an issue's been going on, what happened to them, why they have the wounds or the fractures that they have, how long ago they happened. We have none of that information. So it's a bit of sleuthing to try to figure out what's going on and what to do for particular animals. Like an ER, we never know what might show up. Things are walking through our door every day, all throughout the day, and we just have no idea what's going to come. So that's part of what makes it fun too. Every day is a surprise, but that can be challenging, of course. Sometimes infectious disease management can be challenging. Managing outbreaks when they happen is a lot of work. It's resource intensive. Generally, we get all our animals through just fine, and that's great, but it is a lot of work for everyone, the medical team and the animal care team, especially when that happens. Managing stress and mental health for our animals is one of the big challenges of shelter medicine. It can be a stressful environment, and so doing everything that we can to try to keep animals mentally enriched and healthy while they're here is important. There can be very complex decisions that factor in medical, behavior, quality of life for the animals, and the resources that we have. And then kitten season is a big challenge. There were times in this last year, kitten season, when we would have 6 bottle baby litters come through the door in a single day, and we're scrambling to find fosters for them to go out to and assess their medical needs, and that can be a big challenge. So that is on the horizon. Okay, I'm going to talk about this one complex case that we have actually in our care right now, just so you can kind of get an idea of all the different things that factor into making hard decisions in a shelter. When an animal comes to a general practice with an injury, certainly you need to assess their injuries, figure out what financial resources are available, but in sheltering, we have some other things to factor in as well. So this is Milo. He is in our care right now. He came to us about a week and a half ago. He was brought in by a Good Samaritan, and he obviously had some injuries. He was had a obviously injured right eye, and he was blind in that eye. He had a fractured upper left canine tooth. He had a loose lower left canine tooth. His jaw appeared asymmetric, so kind of crooked on the bottom. And he was hissing at us and running away when he was approached. He also was eating eagerly, so that is a very important thing to factor in. So, we had questions. Is this a feral cat? Is he going to be amenable to treatment? Can we keep him in care if he is hissing and scared to be here? Can we do what we need to do for him given his behavior? But given that he was eating really well, that's at least something where, if he's eating, we can maybe keep him with us a bit longer and figure out what's going on. I provided some pain control, and a couple days later, as you can see on the right, he was leaning into chin scratches. So now he's looking like a much more friendly cat now that he's had a time to settle in. It can be very scary for animals to come into a shelter. And so for the first couple of days, we give them a little grace. They can be quite traumatized by this experience. And he obviously had some severe injuries as well. So with a little time to settle in and a lot of food snacks offered and some pain control on board, he was turning into a reasonably friendly kitty. So I went ahead and sedated him while he was still on stray hold so I could get a better handle on what his injuries were and what kind of treatment he might need. And I found that, well, for one thing, his lower canine tooth just plucked right out. He had a wound on his chin, which I couldn't initially see with how he was allowing me to touch him. So we gave him an antibiotic injection. His left mandible which is the lower jaw, was obviously unstable, and x-rays showed that he had a fracture of that jaw, and he had some granular material, that bright speckly stuff in the chin, which I suspected might have been asphalt or gravel, something like that from his traumatic injury. With that tooth out and ongoing medication and pain control, his face became more symmetric and he looked a lot more comfortable. And so actually just yesterday, that was a couple of days after his initial evaluation, he was off of stray hold. Yesterday we anesthetized him. We got another closer look. We took some dental x-rays. I was able to explore the wound on his chin, pluck out some asphalt, decided to remove that eye, and his jaw fracture was not quite fixable at this point, at least not without keeping him in care for a very long time. So we're going to see how it heals. But, I guess what I want to highlight here is that there's a few really complex things we have to weigh. How severe are these injuries? Do we have the capacity to fix his injuries? Sometimes it can be tricky to decide, will this jaw heal on its own, or do I think that some sort of orthopedic surgery is required for that? But also we have to weigh in, what is his quality of life and care? Is this a cat that's going to need to be with us for 6 weeks? And if he's extremely traumatized being here, is it fair to him to keep him here doing that? And if he weren't eating, certainly that would be another factor. Is he an adoption candidate? Is he behaviorally okay? If he's not, does he have a place where he can return to? And in this case, the person who brought him in had seen him in their neighborhood for quite some time and was feeding him and would be very happy to take him back into their community. So those are a number of things that we're deciding. And so this guy, we're holding the course with him. He's doing really well, and we will see. We'll keep an eye on him for the next couple of weeks, and we'll see if we have to do more with the jaw. Okay, what makes shelter medicine rewarding? Well, obviously the animals. These are two extremely adorable kittens in my lap in my home, which gives me quite a bit of joy. The variety, all kinds of things that we can do here and see, so that is always fun. Coming together as shelter staff is one of the great rewards of working here. My medical team is amazing. Our behavior team, our animal care team, we're all working together in the best interest of these animals, and we care so much about them. Leadership is helping with decisions and making the tough choices. And then we couldn't do what we do without our incredible fosters to help with our medical healing, and our volunteers that are helping all over the shelter. But in our medicine team specifically, that's with in our office as well as in surgeries. And I really love that I can practice high quality medicine in a strategic fashion. I'll talk about another case right now, who also is in our care right now. There is a lot going on, many complex cases. So this is Nala. She is a 4-year-old spayed female that we took as an owner surrender just a few days ago. When I reviewed her medical records, she had a history of several urinary tract infections spanning over a couple of years. They would be treated and come back. When that happens, we want to know, is there a reason why they keep getting urinary tract infections? It's normal to get, maybe one every now and then, but she'd had them repeatedly. And when I read through her notes, the owner said that she had was currently having symptoms again of blood in the urine straining to urinate. So rather than make her adoptable right off because she was spayed and she's behaviorally a lovely little girl, I thought that that merited a little more looking into. So I decided that we should do a urine culture for her and we should do x-rays for her to see if she had some x-rays would show stones, which would be a reason for ongoing urinary tract infections. I love that I can do that here. When an animal is owned, it's up to an owner to decide whether they have the resources or whether they want to try some more things before doing further diagnostics. But here at the shelter, I really feel empowered and able to make whatever I feel like is the appropriate decision for an animal to assess and treat their medical needs. So we collected urine for culture and I did bladder x-rays, and I don't know if you can see that. Can you guys see my cursor? Well, I don't have an answer, but I think probably not.
Yes, I can see it.
Oh, great. Okay, wonderful. Thank you. So these little things right here are actually stainless steel sutures. So that tells to me that when she was previously spayed or had some other abdominal surgery, somebody put stainless steel sutures in her, which happens sometimes. But right here, so this is her bladder. And right here, I can see that there are, in fact, a whole bunch of little stones. So I was really happy to know that. I don't know when this girl came in. I think it was maybe Friday. She was transferred to our shelter from Dublin to Oakland on Tuesday, which is when we usually do our transfers. She had these diagnostics done on Tuesday and saw these stones, and I signed her up for surgery on Wednesday. So in less than a week of being here, we were able to help with this medical issue that she had probably had for quite some time. So that was great. Cystotomy is what that surgery is called. I cut into the bladder. I removed those stones. It's a very fun and rewarding surgery. And those stones now are going to be submitted for analysis. Sometimes people don't have the funding to do that, and that's okay if that's what their resources are, but we do because it's important to know what kind of stone it is, because then you know what causes it and how you can prevent it in the future. So I suspect that these are struvite stones, which are caused by urinary tract infections. And then once they're there, they cause more urinary tract infections. So it's kind of a vicious cycle. But we are sending in those stones for analysis. We are waiting for the culture results and we'll assign antibiotics based on those. And then as soon as I have those results, she'll be available for adoption. And she is adorable and very sweet. So if anyone's looking for a dog like that, I recommend her highly. Her name is Nala. Okay, let's see. Gosh, I could just share so many cases with you. I will talk very briefly about these. Our upper left there are our first two kittens of the season. So hopefully the onslaught won't start quite yet, but these two little bottle babies came in just a couple of days ago. They had eye infection, which is very common in our kittens. Luckily, pretty easy to treat if you do treat it. And we were fortunate enough to be able to call on our bottle baby fosters and have someone pick them up right away. So they spent less than a couple of hours in the shelter, just enough time for us to evaluate them. My team did this on the weekend without me here. They are extraordinarily skilled with kittens and bottle babies in particular. So we just needed to make sure that they were maintaining their warmth, able to bottle feed on their own, or determine whether they needed some extra support, and we need a special foster that is extra skilled at that. Get the eyes evaluated, prescribe some medications, and then they could get right out. The kitty in the middle is an example of how the lack of history can really be a challenge. This is a kitty that came to us stray. She obviously has something going on with her nose there, and just at a glance, We can't tell. Is that an abrasion? Is it a infection from a wound? Is it there's an autoimmune disease that some kitties can get called eosinophilic granuloma. That needs a very different treatment than a wound or an infection. Cats are also prone to getting cancers on their face. So could this be a cancer? There's no way we can, well, we could know it if I did a biopsy or something, but that would be a bit aggressive to do as a first line of treatment. So luckily, I'm going to give a shout out to our fosters again. We have places where these kitties can go and doggies and be monitored. So we tried her on some antibiotics. She did get better in a foster, and so that wound healed and she was ready to go. Darla is on our right. She is also currently in a foster home recovering from an amputation. She came to us as a transfer from another shelter where she was not able to use that leg. It was dangling. They did x-rays and determined that it was an old fracture that had not healed. They did not have capacity to do amputation at their shelter, so they transferred her to us. We got it done right away, and now she's getting better in a foster home. Often we adopt these out right away, but in her case, she also developed kennel cough, a pretty significant case of it. And so we wanted her to have a nice, calm, warm place to heal. This is an example of my rounds list from yesterday. So yesterday, by the way, was a surgery day. I was doing a number of surgeries, including the bladder stone surgery, and while I'm doing that, I have 20 or more animals that are lining up for me to look at. So it can be pretty challenging in shelter medicine, juggling and prioritizing and triaging everything that needs to happen. My team is good about putting little flags on the ones that are most important for me to see right away, and then the other ones, I will get to them as soon as I possibly can. Okay, typical cases in shelter medicine, very common would be underage kittens during kitten season. We get tons of those. Upper respiratory infection is very, very common. Animals often come in with those. Sometimes we get it spreading in our shelter. Sometimes it transfers in with our transfer animals from other shelters, and then we might get a little bit of spread. We are lucky at this shelter that we don't tend to get too much spread in shelter, but animals often do come in with it. Eye infections, especially in kittens, are very common. Ear infections, especially in dogs, are very common. Skin infections, common, sometimes secondary to allergies. Skin parasites, such as mange, very common. Diarrhea, also, especially in our kittens, but also in a stressful environment. Could be due to parasites, could be due to stress, could be due to, weaning or dietary changes. That's very common. Somewhat common is wounds, fractures, trauma of all sorts, which can also include wounds and fractures. Geriatric senior animals are often coming in and they need careful senior exam to evaluate what their issues might be that need treatment or disclosure. Matted fur is pretty common. Tumors of all sorts from small to large, dental disease, and sometimes infectious diseases. Less common would be chronic diseases that often take some workup to figure them out, congenital issues, sometimes that's heart murmurs in our young animals, other sorts of malformations, bladder stones sometimes, GI foreign bodies, and really anything that you can see in a general practice or an ER we might see. Okay. I have so much to say that I'm running a little tight on time, but I'm going to go through this case because it makes me happy. This is Papa John. He came in a year ago. He was one of 3 10-week-old puppies that was found in a park by a Good Sam. All of them had infected wounds on their heads. Why did 3 puppies have infected wounds on their heads? We have no idea. Was it wild animal? I don't know. But we're just going to deal with what we have in front of us. So they were brought in an insulated pizza delivery box, which is why this guy was named Papa John. His siblings were Mountain Mike and Arizmendi. I initially thought he was Papa John because he had all these wounds on his head that kind of looked like pepperoni pizzas, but that was not the reason. He was dehydrated and lethargic when he came in, and he had a high fever, although this was January and it was not hot outside. So we started him on, we gave him fluids, food, antibiotics right off the bat. I wanted him a bit more stable before I really got into trying to assess those wounds. The next day, he was bounced back quite well, and he was doing great. So he was suitable for surgery at that point. When we shaved and revealed those wounds, they were really quite extensive. There were a number of holes basically in his forehead that I had to figure out how to piece together. This is actually one of my favorite things to do. I really love wound care. It's kind of challenging. My grandma taught me to sew when I was young, and I'm a knitter, and so piecing together wounds is fun for me. However, I was gratified that I was able to piece it together, but I knew that this was not the end. Wounds, if they get infected, and he was on antibiotics, but that doesn't necessarily mean that it's the right antibiotic or he won't get infected. If infection happens, these things have a tendency to open up and perhaps damage more tissue. And I was pretty concerned, and I did lose some sleep thinking that if that happened and I lost more skin, was I going to be able to close his head? Of course, I would have figured out a way, but pretty stressful. He went to foster care. He got lots of snuggles and warmth. And he came back just 10 days later looking beautiful. And then just a few days after that, he got his stitches out and was looking just gorgeous and ready to be adopted. The child in the foster home wrote about how he was so brave. He handles injuries so well. He has the face of a little lion cub. They just absolutely adored him. He was adopted the very next day after he was made available. He was adopted by a man and his son who sent us some post-op photos and said he was the love of their life, and they named him Scar because his head looked a little funny and he was always going to have scars. So we really love our happy outcomes. Of course, that's one of the reasons that we do the hard work that we do. Okay, I'm just going to rush through these last couple of cases of all of the animals that we remember and that give us such joy and make our work worth doing. On the left is Sky. She is obviously very pregnant. She came to us extremely pregnant and about to pop, and we were not going to let her do that in a shelter. So I took her home with me, and she gave birth to her babies just a couple of days later. And I will not say it was without stress because while it was an incredibly magical thing to be a part of, she actually had she was not doing well a couple of days after giving birth, and she actually needed an emergency surgery because there was an issue with her uterus, and without that surgery, she would not have survived. So these cases are not easy. In the middle is one of my team members giving treatments in isolation to one of our parvo dogs. We're lucky to be able to do that for our doggies, and they often pull through quite well and quickly. On the right is Bambi. She was a very intensive case of a dog that had mega esophagus. And she actually had a congenital, well, mega esophagus is congenital, but she also had a blood vessel wrapping around her esophagus that was the cause of that. We did do surgery, thoracic surgery for that, but her mega esophagus did persist. But after quite a while, she found a wonderful home. She was really a case where everybody came together. She needed special feeding multiple times a day. Our behavior team worked with her, our animal care staff. People took her home for fostering. It was she was a memorable case for sure. This is Derby or Durian. He came in with the name of Durian because he smelled so very bad. He was found as a stray, as a puppy with horrible skin infection, quite severe, secondary to Demodex mange. One of our wonderful fosters took him home, and she has taken so many animals home, but she ended up adopting him. So on the right is Durian, who she renamed Derby because he wasn't so stinky anymore. And he is in her home living the good life. And then right behind Derby is Gigi in the sweater, and she's an animal in our care right now who is blind and is healing from some medical issues. And so that foster is taking care of her as well. On the left here is a kitty who had a congenital abnormality that is called pectus excavatum. It's an indentation of the sternum, where the sternum points inward into the chest and ends up compressing the chest space, which can lead to compression of the lungs and respiratory difficulty. This kitty did have it severe enough that it needed to be repaired, so she had to have a splint on her sternum while that healed. On the right is a kitty who had a little facelift. She had a condition called entropion, where the eyelids, there's too much tissue and they roll inward. And you can see her eyes look a little angry, the eyeballs themselves, because the fur has been rubbing on them for quite some time. So with a simple little facelift surgery, she went on to have comfortable eyes and feel much better for the rest of her life. The guy on the left had chronic dry eye and cherry eyes. He had chronic ulcers in the left eye, had to have that left eye removed because it was no longer visual and was painful. But the right eye, we repaired the cherry eye and got him on some lifelong medication for dry eye. And he was able to go live a very cute, one-eyed, happy life after that. And then on the right is an adorable bottle baby. And I hope that you all are charmed by the kittens that I've shown you, because kitten season is coming. And we are always looking for fosters. Fostering is very rewarding. It is probably as rewarding as working in shelter medicine. And we need fosters for all kinds of animals, big dogs, animals healing from surgeries or, kennel cough, things like that, and especially people who are willing to take on kittens. When bottle babies come in, we need to get them out to a foster home right away because they need to be fed around the clock, and we can't do that in the shelter. So any type of kitten foster is helpful, but especially if you're someone who can come on short notice and take an animal overnight. And feed them throughout the night, even if it's just for a day or two while we can figure out a more permanent solution. That is very, very helpful to us. So if you are interested, there is the email address of our team. You can also go to our website, How to Help, check out fosters and field trips, and there's a form you can fill out to get started. And we would be gratified for your help. And that is my last slide. So I hope that you have enjoyed this and have some insight into shelter medicine now. And I welcome your questions.
What a wonderful presentation, Dr. Noah. We are so grateful to have all your knowledge and such care for your animals. Thank you so much. We are now going to open it up to questions. Feel free to type your question into the Q&A section at the bottom of your screen, and we'll get to many as possible during this time. So right now I'll pass it over to Julie Henderson.
Thank you, Lindsay. And that was amazing. And seeing the animals and just getting to see the examples of some of the cases to keep in mind, like 3,500 animals came into our shelter last year. So this is just a very small sampling of some of the amazing work that Dr. Noah and her team do. And we're incredibly proud to be able to support that work because it really is amazing. So wanted to get started here with some of the questions that we have in Q&A. Sorry, my computer's giving me a little bit of trouble. But I'm going to let Allison start with this one, even though we kind of hit on it initially in the difference between private and municipal and hybrid shelters. What is the difference between East Bay SPCA and Oakland Animal Services?
Yes, it's a good question, and there is a lot of confusion out there. Oakland Animal Services has the contract with the city of Oakland to take in stray Oakland animals. Now, this does not mean that we do not also take in Oakland stray animals. We just are not contracted by the city to do that. We are a nonprofit. We are not funded by the city. We are funded by the generosity of private donations. And a lot of people will ask me, well, do companies and foundations give you a lot of money? Well, we certainly get a little from them, but really the vast majority of our funding comes from individuals who generously fund our programs. And the more money that we get, obviously, the more that we can do medically, not just in our shelter medicine program, but also the more we can do with our humane advocacy program that deals with owned animals coming into our private vet clinic, which is also open to the general public. We do also assist the city of Oakland by taking in strays, and we communicate very closely with them because the most important thing is to get strays reunited with their people. right after keeping people with their pets in the first place, but reuniting strays with their people. So whenever we get a stray, because our gates are literally open 7 days a week, and either our clinic or shelter is open, so there are always staff available, we will take in the stray, inform the city of Oakland so that we can cross promote that we have found this animal. Additionally, we send staff every week to Oakland Animal Services to pull animals from their shelter to help alleviate any potential overcrowding. We definitely want to take on as many animals as we can to help share the burden of the real overpopulation problem that we have right now.
Fantastic. Thanks, Allison. Josie, I'll let you answer this one. So when is kitten season technically?
Well, it can be all year long, but the bulk of it is starting in usually April to May is the high period. It really goes from, I mean, obviously we're starting just at the end of February, but really like March to October is when things are really happening. And that's when our neonates are coming in from a day old. We'll get them umbilical cord still attached to older ones that are maybe eating on their own or need some bottle feeding, as the neonates do as well. Yeah, but the bulk of it, it's really going to start ramping up in March, especially April and May. So that's when we really need your help, but all year round too.
Fantastic. So here's a question. What does the shelter do with animals that don't get adopted? Is there a time limit for how long they can be in shelter? I can answer this. So since we are a private organization and our money comes from private funding and donations, we never euthanize for time or space. It would only be under the instances of severe medical or behavioral issues. And when I say severe, you can see some of the cases and the length of, resources that we put into every animal that comes into the shelter. So it's, one of those things where we're really lucky to have animals here until we can find them the right placement. So unless Allison or Josie wants to elaborate on that.
I would just like to say that for some of our animals that are here for a longer period of time, we do really try to give them breaks from the shelter. So that's one of the things that the foster team does is posting our animals for foster and trying to get those animals out that have been here for a long time to at least give them a break of a week or two or a month or, even just field trips or outings to try to relieve some of the monotony of being here for a long period of time.
Josie, this is for you. How can we support your team besides just donating money?
Well, you can foster, obviously. I mean, really, there are so many ways to volunteer at the shelter. And, while some people do volunteer specifically for my team, helping with surgery or helping in the office itself, really anything you're doing to help the East Bay SPCA as a volunteer is going to help the health of the animals. Everything contributes to their health. So whether that's, socializing, walking, cleaning, all of those things are going to keep them healthier while they're here. Data entry is going to get them moving through and available for adoption more quickly. There are people who take photos or write adoption bios, any of that that's going to help get the animals out quickly as possible, and keep their mental health good while they're here. All of those things are helping them medically as well as in every other way.
And this is just a question that we had earlier. So if you had unlimited resources, what would be the things that you would want to invest in to try to make things better for your team and to be able to do even more than you're doing right now?
Well, I think, my team has grown a lot since I've started, and we are working in a pretty tight space. So I think the things that I would most pie in the sky dream of would be a little more space to work in. Remodeling doesn't come easy, but that would be a dream. And then just, increased housing for our animals would be wonderful.
Fantastic. Okay. Here's a question. So is it possible to delay neutering for larger breed puppies after adoption?
So we cannot do that as a shelter because we must adopt out our animals altered.
So this is a comment from Brittany Benzani, just a comment to say, Josie, you are amazing. And Brittany, obviously, we know well. But if you'd like to comment back, Josie, she can't. So she just wanted to say how fantastic you were and how great your presentation was. So.
Oh, thank you, Brittany. You may have noticed that you were featured in 2 photos in here. Brittany was an amazing RVT with us for more than 10 years, and she has moved across the country, sadly. But hi, Brittany.
Okay. Here's a question about neighborhood strays. So I take care of strays in our neighborhood, stray cats, that is. Is there a process for getting involved with the SPCA for these cats to be listed as adoptable fosters? He's not trying to give them for care, but doesn't have the capacity or knowledge or range to find adopters or vet them. So I can also let Allison jump in on this, but we do have a pretty extensive stray and community cat policy that's available on our website. And really, we follow guidelines to include that unless there's severe illness or injury, we often recommend that cats that look healthy and are doing well and thriving in the community are better to be kept in the community that they're in. If we can do, we do support with San Leandro and Livermore, where we'll do trap and release. So we can help with assistance in bringing those animals in to get them altered so that they can be re-released. But really, like, animals that were born in the community are better off and will strive better outside of a home or shelter environment. So that, with the resources we have, we really have to focus on, like, getting animals adopted that come to us through owner surrender or other shelters. But if there's any additional questions about this, please feel free one-on-one to email me. My name's Julie Henderson, and my email address is jhenderson@eastbayspca.com. It was in all the emails that went out. So happy to provide any conversation or assistance in addition to this that we can. So, Allison, did you want to comment at all, or do you think I covered that well?
I think that you covered it well. I think that the other comment I would add is if you are able to get kittens, obviously you don't want them to be taken from their mother pre-weaned, but if there's an extenuating circumstance where the mother cat has been killed or it looks like they're in a very unsafe place, if you can get them to us, I mean, these young kittens, if we can get them in time before they become feral and untractable, we would be happy to get, take them into our care, get them spayed, neutered, vaccinated, and get them out for adoption. So that would be, an outlier to that. And we do have people that will bring in kittens to us. And if we get them, at the right time, even if they do require some fostering, that's fine. Obviously the younger they are, the higher mortality rate they face without their mother, but we will take them in and do our very best to socialize them, get them healthy, and get them out. It's just once they become adult or adolescent cats and have really developed an aversion to humans, they really would suffer quite profoundly in a shelter situation.
Okay, this is a very specific question. On an occasional dog field trip, an overnight foster volunteer that worries that the dog's getting ticks and Lyme disease in some of the areas that they like to hike. Does the flea and tick medication you mentioned actually prevent tick bites and tick-borne diseases?
Yeah, so every dog in our care is consistently on flea and tick preventative, and that medication should be killing those ticks within 12 hours if they were to bite the animal. It depends a little bit on the disease, but most of those tick-borne diseases are going to take 36 hours of attachment in order for disease to be transmitted from the tick to the animal. So having them on that preventative will kill the tick before they're able to transmit disease.
Does someone need a specific experience in order to help out with the veterinary volunteer portion?
No, we have people coming to us with very little experience. A lot of people are coming to us specifically because they want to get experience. So if you are interested, you can certainly look on the website, reach out to our volunteer coordinator through the website, and he will help match people with appropriate spots within the organization that currently need help.
Great. How do you do outreach to find potential adopters for the animals? I can let Josie answer from the fostering perspective in terms of medical cases, but in terms of the East Bay SPCA as an organization, I'll just say, we've been here for over 150 years. We have a wonderful reputation throughout the entire Bay Area. We get, like hundreds of thousands of hits on our website every year where people can visit. They can learn about the animals online. We have 2 adoption centers opened Wednesday through Sunday every week to the public from 11 to 5. So people can come and meet the animals in person. They can talk to our staff. So we do a lot of networking, like a lot of advertising. We do everything we can to get the word out in the community that we have wonderful, healthy, adoptable animals here available for the public at all times.
Yeah, and regarding fostering specifically, I'm not sure if the question was about that, but yeah, I mean, same thing through social media. We're always trying to gather fosters. We do have on that spot on our website that's on this page here, the Fosters and Field Trips, there is a link to a Trello page, which is a bulletin board that has all the animals that are currently looking for fosters, field trips, or sleepovers. Sometimes there are very specific animals that we will reach out to our known fosters and sort of cherry pick just the right foster for that animal that we know can deal with their issues. But for the most part, people are just coming to us, finding us, and going to that Trello page and reaching out via email for fostering and field trips.
Sorry, Josie, I should have prefaced it with, like, for people that end up sometimes adopting some of the severe medical cases, the foster to adopt path, which happens quite easy sometimes.
That happens.
Okay, final question that I see here, and then we're gonna need to wrap up because we're running out of time, is how is the East Bay SPCA shelter clinic associated with the public clinic that people can bring their pets to?
Well, we're right next door. We do collaborate to some extent. So, obviously we all work together. We are in close communication. There are times when people will bring their animals into the clinic and may not be able to deal with their medical needs. And so at times, conversations will happen to either hopefully help them if they want to keep their animal, get those medical needs addressed with some support. Sometimes people really want to surrender their pets. And so sometimes animals will come from the clinic and actually be transferred into the shelter. The clinic also helps us when they have capacity. If they have space on their surgical schedule, they will offer to take some animals from us to do their surgeries. On days that I'm not here, if there's a doctor there, they will often deal with urgent medical issues that come up. So we work closely together and sort of dovetail together and help each other out as needed.
Fantastic. Okay, I think that's time. That's all the questions, and that's all the time we've got for questions. Lindsay, do you want to close up for us?
Yeah, thank you so much, you all, for joining us today. I just want to thank you all on behalf of East Bay SPCA. Our work here is possible because of supporters like you. If you are interested in ways you can help, we certainly need it. Fostering is a huge assistance to us. Volunteering or donating is also very helpful. So please don't hesitate to reach out and anytime, and we are grateful for your support. I want to wish you a wonderful afternoon, and we hope to see you at the next one. Thank you.